Radiological Anatomy of upper limb for the anatomy viva, in which we will be having the x-rays of the shoulder region, the x-ray of the elbow region, and the x-ray of the hand. This is the x-ray of the shoulder region. It is seen in the AP view, which means the antero-posterior view. The x-rays come from the anterior side and go to the posterior side. It is a plain radiograph because there is no special dye that is used. The x-ray is of the left side. So it is a left-sided x-ray of the shoulder region. The structures seen are the upper end of humerus, mostly the head of the humerus, the greater and lesser tubercles and intertubercular sulcus. You can see the scapula, you can see the clavicle, and also the upper ribs. The coracoid process and the acromion process are also visible. We can clearly see the lateral end of clavicle articulating with the acromion process, forming the acromioclavicular joint. The joint space is filled with articular cartilage, but the articular cartilage is radiolucent, hence it is seen as a black shadow. The bones are radio-opaque, so they are seen as proper white shadows. The epiphyseal lines that are normal can be mistaken as fracture lines. So to differentiate between the two, fracture lines have irregular margins. They are asymmetrical lines on the bone and they may have a break in their continuity. On the other hand, the epiphyseal line is always regular and bilaterally symmetrical, and it is seen as a gap in the bone. There are two joints in the shoulder region. One is the shoulder joint itself and the second one is the acromioclavicular joint. This is the x-ray of the elbow region. It is a plain radiograph because no special dye is used. The structures that are visible are the lower end of humerus, the upper end of ulna, and the upper end of radius. The olecranon process of ulna is visible because this is the lateral view of the elbow joint. The joints present in the elbow region are the elbow joint itself and the superior radio-ulnar joint. In your anatomy viva, they may give you the lateral view of the elbow or the AP view of the elbow or both. This is the plain radiograph of the hand. It is seen in the AP view, which is the antero-posterior view. The structures visible in this X-ray are the lower end of radius, the lower end of ulna, the 8 carpal bones, metacarpals. The examiner might ask you to point out and name each of the 8 carpal bones. In the AP view of the hand, we can see that the triquetral and pisiform bones are overlapping each other. We can also see that the trapezoid overlaps the trapezium. A small unnamed sesamoid bone is seen near the head of the first metacarpal. In the X-ray of the hand, we can see the wrist joint. The wrist joint is the common site for age determination because each of the 8 carpal bones ossifies at a different age. Also, the ossification for the lower end of radius and ulna occurs at a certain age. So, by checking whether or not the epiphyses of these bones have fused, we can easily determine the age of the person just by checking the X-ray. For example, if the epiphyses have not been fused, it is definitely the X-ray of a child and not that of an adult. Ossification of scaphoid happens at the age of 5 years. Ossification of lunate occurs at the age of 4 years. Ossification of triquetral occurs at the age of 3 years. Ossification of pisiform occurs at the age of 12 years. Ossification of trapezium occurs at the age of 5 years. Ossification of trapezoid occurs at the age of 5 years. ossification of capitate occurs at 2 months and ossification of hamate occurs at 3 months. So, if pisiform has not yet ossified, we can just say that the X-ray is that of a child below the age of 12 years. The ossification for lower ends of radius and ulna completes at the age of 18 to 20. So, in the X-ray, if we see that the lower ends of radius and ulna have been completely ossified, we can say that the X-ray is that of an adult.